Hi, Dr. Gary on the road. We sell dental practices nationwide. Today's topic is new buyer totally overestimates the cost to renovate a practice, to renovate a dental practice. So we're going to get into that. Anyway, we are now in 28 states with 10 employees, including 2 CPA accountants, and we're available to you every day except Christmas and Easter. Always available. So please give us a call and we'll get you started with your buyer or seller. Our phone number is 201-663-0935, and our email or our website is dentalpracticeguide.com, and also nationwidedentalpracticebrokers.com. You can always reach us. 8 a.m. to 9 p.m. East Coast time. So just give us a ring 363 days a year. We're always picking up. Now, the information you're about to hear is for entertainment purposes only. It's not legal or business advice. Also, if you're thinking about selling to a DSO, please give us a call, because we work with them all. We know what's going on. Some of them are actually having trouble now. We'll steer you clear. We're independent. But often they will pay our commission, so there's no commission to the seller. And if you work with us under certain situations with certain criteria, we can get your legal fees reimbursed upon closing. So, and we've done that a number of times. So please give us a ring and we'll give you the information. Anyway, so we have a situation now. We have about a $200,000 practice. That's only part-time, about a day and a half a week. And it's a PPO, fee-for-service, with some Medicaid to it. So the buyer is coming in and the seller wants to get rid of it. I'm going to sell it at a very reasonable price. But the buyer is getting all worked up and miscalculates how much it's going to cost to renovate the practice. With a practice like this, it's only grossing on $200,000. It's in a little bit lower socioeconomic area. You don't have to go out and buy super brand new equipment immediately. You can do it at a later time. But the x-rays on the wall are functional. The compressor, the suction is functional. You don't have to change that right away. And if the chairs, you don't like the chairs, okay. There's used chairs, really quality used equipment. I know a couple dealers. I don't get involved with it, but I could steer you to the right people to do. I don't make anything out of it. It's just I want to get you in the right hands. So where a buyer thought that this renovations are going to cost $240,000 for like 900 square feet, 3 operatories, I'm saying to them, wait a minute. The walls are up, the plumbing is in, the practice is making money, the lighting is in, everything's done as far as the structure. So you could change the reception area, you could paint, you could change out the chairs, unit lights, for a fraction of the cost of doing it brand new. You know, one of the most time-consuming things is the construction. You're tearing down all the walls, you're putting up everything. It's just crazy. You don't have to do that. The walls are up, the plumbing is in, everything's done for you. Change out the rooms piece by piece. If you don't like the countertops, we can pick up some newer countertops, or they may have some of the used places that you can customize to your office. But certainly the chair unit light, you could get that reasonable, and x-ray, and compressors, and suction, and sterilization units. You don't have to buy those things brand new. I know you'd like to buy them brand new so it's shiny, it doesn't have any marks on them. I understand that. But this practice is grossing $200 or less. It may not warrant right now dumping all that money into it. What you could do is go slow and easy and do some quick renovations with some used equipment, and it'll be significantly less than you anticipate. I mean, a fraction of it. Probably do it under $30,000, and you're thinking you got to spend $240,000. No, because I spoke to the used equipment fellow. With ADEC equipment, air techniques, air compressors, and suction, you can get it done for a lot cheaper and get working right away. Put that extra money that you would have borrowed and put it into advertising. You don't need a CAT scan on a $200,000 practice right away. You know that they can go to the radiologist. You know they have the mobile CAT scan units that come to you. You don't have to do that right away. You can take your time and do one at a time and get it rolling, one room at a time. So just be aware of that. And I realize you want that brand new shiny equipment. Some of the older ADEC equipment is really solid. Great motors and hydraulics and so forth to it, and they'll last a long time. So the compressor's going to last 20 years. So if you buy one that's 4 or 5 years old, what's the big deal? You know? So it's not brand new, but if it's going to last 20 years and yours is going to last 15 or 18 years, what's the big deal? So don't get carried away when it comes to these renovations. You don't have to spend a dramatic amount of money. Don't make the mistake that these doctors were going to make, and I think they're going to listen to me. This way they're not carrying even a bigger note on a $200,000 practice. They're carrying a smaller note for that equipment. All right? And I think it'll work out. I did this when I was a dentist for 25 years, and I often bought some quality used equipment. Occasionally I bought new stuff, sure. But, you know, we got by, and it worked out well, and the patient doesn't know what kind of compressor you have, what kind of suction you have. They don't know. You want the appearance, you want a nice reception area? Yeah, certainly. But a paint job, new flooring, new carpeting can make a heck of a difference rather than blowing all your money on something. All right? So just think about that. We'll be in touch with you. We have a lot of new practices for sales. Please stay in touch. See our email blast that goes out every month. We're here to help you out, okay? If you need advice, appraisal, whatever you need, we can assist you. Thank you for listening. Look forward to speaking to you soon. Bye now.